Marlena Pellegrino says working on the front lines of the coronavirus pandemic is emotionally and physically exhausting. The Worcester woman hasn't experienced anything like it in her 33 years as a nurse.
Our whole world has changed in the hospitals.
Pellegrino works at St. Vincent Hospital and says COVID-19 patients are taken care of in 3 main units as well as the ICU. She says the patient's health can collapse fast and require critical care.
You're monitoring their blood pressure, obviously their vital signs, keeping their fever down. Their respiratory status is very, very important. If they're short of breath, you're giving them oxygen.
Everyone in the hospital wears surgical masks, and people working with COVID patients wear a gown, gloves, an N95 mask, and face shield. The PPE stock is low, so nurses have to wear the same set of equipment all day long.
It's not the highest standard. Nurses feel it can be dangerous. There is room for cross-contamination.
Pellegrino's biggest fear is not having enough PPE and staff when a surge of patients is expected in a week or two.
We're asking the hospital to use this grace period now that we have all this abundance of nurses that don't have a particular assignment right now, to train.
COVID-19 has hit even closer to home for Pellegrino. Her Uncle Joe died from it last week.
He was a very vibrant, funny character.
And her cousin who cared for him also tested positive and is on a ventilator.
You put on your uniform and you go to work after that, but it's always in the back of your mind.
Pellegrino says the virus is personal for many people and will impact more families. She and her coworkers are trying to offer support and lift each other's spirits.
We've been encouraging nurses and other healthcare professionals to keep a journal about your different shifts and what's been going on day to day, how you feel, what you've been doing, so that maybe we can learn from this.